The Centers for Disease Control is urging Americans to prepare for this year's flu season. About 520% people in the United States will become infected with influenza. Reporter Daisy Merida has more.
Thank you. I am with Dr. Elio Spinello, who is a part-time faculty member at CSUN's Department of Health Sciences. Thank you for joining us today, Dr. Spinello.
You're welcome.
Okay, so the CDC estimates that each year more than 200,000 people are hospitalized due to flu-related complications. So there's a lot of misconceptions and confusion about when the flu season usually begins and when does it end. Can you describe that?
Normally in the northern hemisphere, flu season typically is thought of as going from about October through March. Peak months are generally December, January, and February. Really important to note though, you can get the flu anytime during the year. Those are just the months where the most numbers of cases are typically found.
So why should Americans care about the flu?
Well, each year there are about 1,500 to 2,000 deaths directly related to influenza, plus a large number that are related to pneumonia and influenza together. In addition to the mortality risk, there's a large number of cases that produce some sort of economic impact.
So what should Americans do to prevent the flu?
Well, the most basic thing that they can do is frequent hand washing. That means 20 seconds under hot running water with soap. This is particularly important if there's someone in the household or in the workplace that they come into contact with who has flu symptoms. The next most important thing is getting the flu shot. The annual flu vaccine typically reduces the risk of getting the flu up to about 60% in most people. It can reduce the risk of hospitalization 70 to 80%.
So health officials say that half of Americans aren't getting the protection that's available for them. Just 1/3 of adults last year received a vaccination. So coming from a health perspective, if the flu is easily prevented, why, in your opinion, do so many Americans avoid and ignore vaccinations?
Well, typically falls into one of three categories. The first is the belief that it's not going to work for them. And generally, you'll see anecdotally the person who says, I know someone who got a flu shot and then they ended up getting the flu. I don't think it works. The second is the individual who is concerned that there may be some sort of adverse effect from the flu vaccine. I've had students tell me that they don't get a flu shot because they believe it gives you the flu. And this is usually based on the anecdotal account of someone who got the flu shot and then sometime immediately after that became sick with the flu. Generally, when that happens, it's almost always a coincidental event where they were infected sometime before the flu shot, got the flu shot, and sometime after the symptoms became evident. And generally, those are typically the most common things. And then finally, there's the person who believes that I just don't get sick. I've never gotten the flu. I don't need a flu shot. Unfortunately, not having been sick in the past is generally not a very good predictor of what is going to happen in the future.
Okay, so what about people who have received a vaccination? Are they still able to pass a flu virus?
If they're infected, yes, but typically they need to become symptomatic at the point that they begin to pass it along. So generally, the idea behind the flu vaccine is that it stimulates the production of antibodies which fight off the infection. The person doesn't really ever get sick, thereby making it less likely that they're going to pass it on to anyone else. And that's actually a very important aspect of this, is someone who is not vaccinated is much more likely to pass it on to someone else. Of the 1,500 to 2,000 deaths that occur annually, 80–90% of those are among people age 65 and older. So not having a vaccine in a younger person who is able to fight it off more readily puts someone in an older age category that they may come into contact with at an increased risk.
And who is mostly at high risk from getting the flu?
High risk is typically of getting it almost everyone. In terms of fatalities, it's typically the very young and the very old.
Is there anything else you would like to add?
Well, it's a combination of all of those factors: the frequent hand washing, the flu shot, making sure to avoid other individuals if you feel any symptoms at all. But in combination, that's the best way to produce the prevention of the flu over time and to reduce the risk.
Thank you for joining us today, Dr. Spinello.
You're very welcome.
Back to you.